Mr. Ashok, a 75-year-old man who is a reformed smoker, presents in the emergency department with a gangrene in the left toes. His surgeon assesses the gangrene and recommends left ankle amputation. Even after amputation, the wound does not heal well and Mr. Ashok's condition becomes worse. The surgeon refers Mr. Ashok to Dr. Raghu, who performs a lower limb vascular assessment. Vascular assessment shows blocks in the lower limb arteries. Dr. Raghu then performs angioplasty to remove the blocks. Critical limb ischemia refers to severe compromise of blood flow to a limb which causes severe limb pain at rest or even loss of limb. It is the most advanced form of peripheral artery disease. CLI is prevalent in 2% patients over 70 years of age. Within 1 year of diagnosis, 40 to 50% patients have an amputation and 25% die. Amputation occurs when there is marked ischemia of the limb owing to reduction of blood flow and increased demand in the limb. Ischemia is caused when there is reduced blood supply in conditions like diabetes, renal or heart failure, vasospastic disease and smoking. Ischemia is caused by states where there is increased demand for blood supply like infection, skin breakdown, trauma, and osteomyelitis. CLI diagnosis can be done by duplex ultrasound, digital subtraction angiography, magnetic resonance angiography, computed tomographic angiography. The key steps in managing CLI are revascularization, offloading, wound care and correction of orthopedic deformity if present. Without revascularization, amputation leads to limb loss. Limb loss affects the opposite limb in 50% cases. Patients with amputation have 75% chances of dying in next 2 years. Based on diagnostic tests, it can be determined if the CLI can be treated by endovascular or surgical approach. Post-intervention, wound care and modification of atherosclerosis risk factors should be emphasized upon. After angioplasty, the blood supply to the wound has restored and the wound healed well. The wounds that do not have good blood supply typically takes 1 to 2 years to heal, whereas after restoring blood supply, the wound heals within 2 to 4 weeks. The amputation is also small and does not affect functionality of the limb. Dr.C.Raghu at Aster Prime Hospital is the best doctor to treat vascular disorders. At Aster Prime, we provide 24/7 cath lab services for assessment of CLI, Philips cath lab system which is the best in the world, other advanced diagnostics for CLI assessment and management, and a highly trained staff. You could contact Aster Prime by direct appointment, through video consultation or through website.